My name is Patrick Counts. I've been a PA for about 5 years now. I went to the University of Kentucky for PA school to receive my training. Prior to that, I was in law enforcement for about 10 years. I transitioned from law enforcement to medicine. My son at the time had been diagnosed with leukemia, so being in the environment where we had medicine and questions and things like that, I started doing my own research and I wanted to get into medicine, so that's why I transitioned to medicine. So why I picked Central Kentucky Pain and Spine and interventional pain. So just out of PA school, I was infectious disease. I did that for about 3.5 years. Pretty much 90% of my patients that I saw, depending on what their ailment was, had some sort of acute or chronic pain syndrome. 20.5% of Americans suffer from chronic pain. That number is probably a little bit higher, but it's one of those things that everybody deals with, whether it's your family, your friends, somebody you know. So it's something to as far as a knowledge base and to be able to help, it's where I want to be. Some of the common conditions we treat are low back pain, so definitely spinal pain. So low back pain, thoracic pain, cervical pain. We do SI or sacroiliac joint pain. We do compression fracture treatments, which is a kyphoplasty. We treat migraines, any type of muscle pain or myofascial pain, joint pain, pretty much any type of pain we treat. Interventional pain does not really have the opioid stigma as other pain clinics do, which is why I like interventional pain. So what our job typically is to take patients who have been on chronic pain medications for 10 or more years and transition them, so taper them down and use interventional techniques to control their pain. So new techniques or approaches that excite me are the minimally invasive techniques. So the SI fusion for sacroiliac joint pain, as well as posterior arthrodesis, which AKA the Minuteman procedure, which helps with stenosis in the low spine, lumbar spine area with patients with conditions called spondylolisthesis. So working in the community-based hospital system, to me, the patient population is a little bit easier to deal with. It's kind of that old, the old family feel, when you get to know your patients, not only about their ailments, but about their family as well. So it's easier to establish a relationship with a patient, which is 80% of the treatment. Knowing the patient, knowing their pain, it's easy to treat after that. So that's kind of why I like this type of feel with Georgetown. If you know friends or family that have pain, or if you have pain yourself, from head to toe, give us a call, come in and talk with us, and we'll treat your pain.